I was headed for retirement, and my retirement was going to buy a boat, and I was going to live on it. When I stopped looking at boats, I think that's when she got nervous. My primary found a lump on my neck, which they biopsied, and it was non-Hodgkin's lymphoma, and we decided we'd do watchful waiting. And there was no symptoms, there was nothing. I just went and got a scan every now and then and did some blood work. And for 3 years, I started to get sick. Shortness of breath, tired.
At its worst, he was capable of getting up and going to the bathroom, and then he'd go back to bed. It was the day before Thanksgiving. The oncologist called and said, "You have diffuse large B-cell lymphoma and need chemo. Have a happy Thanksgiving." He had had a scan. After probably about 4 or 5 weeks, they said, "The cancer is growing. There is no need to continue these treatments."
My oncologist said, "We don't have anything here, but I have a friend at the other hospital that has a bunch of trials going on, and we think that possibly he can help you." The doctor, he was fantastic. I said, when I go back, he spent the 2 hours with us. He went through everything. He asked us what we thought, how we felt, and the CAR T-cell therapy was one of the first ones on his list, and it just sounded really good to me.
He introduced what turned out to be Breyanzi CAR T-cell therapy.
With the CAR T, they did the infusion. The nurse came in, and there was a whiteboard in the room, and she wrote on the board, "This is your day 1." And the whole time I was there, they would come in every day and they would change that to 2, to 3, you know. At that point, there was a lot of hope. The next day, it started to sink in that this was probably really going to work because I could start to do things again. Not that it was much, but it was a start, and it was more than I'd been doing.
By the end of this hospital stay, we were walking laps around the whole unit.
I had a good experience with Breyanzi. They monitored me for side effects, blood pressure, temperature, and all that.
They were looking for neurotoxicity and other side effects.
With the exception of elevated temperature, everything went really well for me, and I'm sure everybody's different. They put up 2 scans on the board, and in the scan, the cancer shows up as a light. My 30-day-ago scan, my whole abdomen and halfway up my back was just a bright light. And the one they took that morning, just black.
To see that difference on the screen was remarkable, and I was crying. The nurse practitioner who took care of him was crying. The doctor was beaming. And everybody looked at him and he said, "Wow, no wonder I didn't feel good." That was his response. But then, so that must have been October? Beginning of October, and by January he bought a boat.
You realize how short life can be and how lucky you are, and there's no reason to put things on hold.
We're lucky.
Indications. Breyanzi is a prescription medicine used to treat a type of non-Hodgkin lymphoma, large B-cell lymphoma, when your first treatment has not worked, or your cancer returned within a year of your first treatment, or your first treatment has not worked, or your cancer returned after the first treatment, and you are not eligible for hematopoietic stem cell transplantation because of medical conditions or age, or 2 or more kinds of treatment have not worked or stopped working. Breyanzi is different than other cancer medicines because it is made from your own white blood cells, which have been genetically modified to recognize and attack your lymphoma cells. Important safety information. What is the most important information I should know about Breyanzi? Breyanzi may cause side effects that are life-threatening and can lead to death. Call your healthcare provider or get emergency help right away if you get any of the following: difficulty breathing, fever 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, shaking chills, confusion, severe nausea, vomiting, diarrhea, fast or irregular heartbeat, dizziness, lightheadedness, severe fatigue or weakness. It is important that you tell your healthcare providers that you have received Breyanzi and to show them your Breyanzi patient wallet card. Your healthcare provider may give you other medicines to treat your side effects. Before getting Breyanzi, tell your healthcare provider about all your medical problems, including if you have or have had neurologic problems such as seizures, stroke, or memory loss, lung or breathing problems, heart problems, liver problems, kidney problems, a recent or active infection. Tell your healthcare provider about all the medications you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How will I receive Breyanzi? Breyanzi is made from your own white blood cells, so your blood will be collected by a process called leukapheresis. It takes about 3 to 4 weeks from the time your cells are received at the manufacturing site and are available to be shipped back to your healthcare provider, but the time may vary. Before you get Breyanzi, you will get 3 days of chemotherapy to prepare your body. When your Breyanzi is ready, your healthcare provider will give it to you through a catheter placed into your vein, intravenous infusion. Breyanzi is given as infusions of 2 different cell types. You will receive infusions of one cell type, immediately followed by the other cell type. The time for infusion will vary, but will usually be less than 15 minutes for each of the 2 cell types. During the first week, you will be monitored daily. You should plan to stay close to a healthcare facility for at least 2 weeks after getting Breyanzi. Your healthcare provider will check to see that your treatment is working and help you with any side effects that may occur. You may be hospitalized for side effects. Your healthcare provider will discharge you if your side effects are under control and it is safe for you to leave the hospital. Your healthcare provider will want to do blood tests to follow your progress. It is important that you do have your blood tested. If you miss an appointment, call your healthcare provider as soon as possible to reschedule. What should I avoid after receiving Breyanzi? Avoid driving for at least 2 weeks after you get Breyanzi. Do not donate blood, organs, tissues, or cells for transplantation. What are the possible or reasonably likely side effects of Breyanzi? The most common side effects of Breyanzi are fatigue, difficulty breathing, fever 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, shaking chills, confusion, difficulty speaking or slurred speech, severe nausea, vomiting, diarrhea, headache, dizziness, lightheadedness, fast or irregular heartbeat, swelling, low blood pressure, muscle pain. Breyanzi can increase the risk of life-threatening infections that may lead to death. Tell your healthcare provider right away if you develop fever, chills, or any signs or symptoms of an infection. Breyanzi can lower 1 or more types of your blood cells, red blood cells, white blood cells, or platelets. After treatment, your healthcare provider will test your blood to check for this. Tell your healthcare provider right away if you get a fever, are feeling tired, or have bruising or bleeding. Breyanzi may increase your risk of getting cancers, including certain types of blood cancers. Your healthcare provider should monitor you for this. Having Breyanzi in your blood may cause a false positive HIV test result by some commercial tests. These are not all the possible side effects of Breyanzi. Call your doctor for medical advice about side effects. For more information, go to Breyanzi.com or call 1-888-805-4555. You may report side effects to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including boxed warnings and medication guide.